Hello everyone, myself Dr. Apoorva Srijayadeva, Consultant Medical Gastroenterologist, Department of Medical Gastroenterology, Indiana Hospital. Today I will be talking about gastroesophageal reflux disease, nothing but GERD. It is a chronic medical condition where the gastric contents reflux back into the esophagus. The prevalence in India ranges from 8% to 12%. It may go as high as in the Western population up to 20%. The main risk factor for development of gastroesophageal reflux disease are smoking, alcohol intake, obesity, eating habits like late night eating or taking heavy meals, like high fatty diet, then consumption of beverages like, as I mentioned, alcohol, coffee, and certain connective tissue disorders, and drugs like aspirin and phosphate based drugs are the commonest risk factor for developing GERD. What are the symptoms? Symptoms mainly, patient may complain of heartburn. Heartburn, nothing but a retrosternal burning sensation. Usually it increases postprandial after having consumption of the food, and sometimes it may be worse during night times. Second commonest symptom is chest pain, and followed by patient can also complain of difficulty in swallowing, any soreness or bitterness in the throat. If acid reflux are more in the night times, patient may have chronic cough, globus sensation, worsening of the asthma, laryngitis, hoarseness of voice in severe cases. So if these symptoms are there, what we have to suspect is GERD initially. GERD, how to diagnose? The most important tool is upper GI endoscopy. Then if found to have a GERD, then followed with a pH metry, ambulatory pH metry, in certain cases manometry, and for certain cases X-ray also play an important role. What are the complications of GERD? Complications mainly include patient may develop esophagitis, esophageal stricture, esophageal ulcer, or sometimes Barrett's esophagus. In a longer run, you may also develop esophageal carcinoma. How to treat the GERD? The mainly three methods: pharmacological therapy, endoscopic therapy, surgical therapy. Pharmacological therapy, it includes the drugs which reduces the acid secretion, mainly proton H2 blockers. The main drugs which we use are cimetidine, ranitidine, famotidine, nazotidine. Most commonly used is ranitidine. Whereas the drugs which completely blocks the acid secretion are proton pump inhibitors. Commonly used one are omeprazole, pantoprazole, esomeprazole, lansoprazole, dexlansoprazole. Usually the dosage varies from 20 milligrams to up to 80 milligrams based on the requirement. And certain antacids also play an important role in treating gastroesophageal reflux disease. Endoscopic therapy, we do a transoral fundoplication. Then other endoscopic therapy is link system, and surgically we do fundoplication, lap as well as open, preferably laparoscopic fundoplication. Thank you.